Will the future of nursing education be virtual? Let's dive into this evolving landscape. In the heart of this digital epoch, online nursing education is not just a fleeting trend, it's becoming a cornerstone of learning in the healthcare sector. As we shift from the traditional chalk and talk to interactive digital classrooms, the way nurses are trained is undergoing a significant transformation. This change is driven by the need to stay abreast of rapid technological advancements that are reshaping education across the globe. The migration to online platforms offers unprecedented flexibility and accessibility, making it possible for aspiring nurses from all walks of life to pursue their careers without the constraints of geographical and time barriers. However, this shift also demands an update in skills and learning approaches, both for students and educators. Adapting to online learning environments is not merely about logging into a portal. It involves a comprehensive understanding of digital tools and resources that are now integral to education. As we navigate through these changes, understanding the pros and cons of online nursing education becomes crucial. Imagine managing your studies on your own schedule. How does that sound? In the realm of online nursing programs, flexibility isn't just a perk, it's a game changer. Picture this. It's midnight, and while the city sleeps, a nursing student logs into their virtual classroom. This isn't an exception but a common scenario in the digital learning environment. Online programs allow students to tailor their education to their personal and professional lives, making it possible to pursue a degree while balancing work and family commitments. Consider Sarah, a dedicated nurse and a mother of two. Traditional schooling would require her to juggle her shifts and family time precariously. However, with an online program, she attends lectures after her kids are in bed and studies during quiet moments at work. This isn't merely convenient, it's transformative. Moreover, the beauty of online education lies in its asynchronous classes. Students like Sarah aren't bound by rigid timetables. They can access lectures, resources, and assignments anytime, from anywhere. Whether it's early morning or late at night, the learning resources are just a click away, accessible 24 hours a day, 7 days a week. This level of flexibility empowers students to not only manage their time more effectively, but also to engage with their studies in a manner that suits their individual learning styles and life circumstances. Flexibility is a significant advantage, but what about the hands-on experience that nursing demands? Nursing is as much about skills as it is about knowledge. As the world embraces digital education, nursing students might wonder how well an online platform can equip them with the hands-on experiences essential for their profession. One of the primary challenges facing online nursing students is the acquisition of clinical skills that are typically learned through direct physical interaction with patients. Skills like administering injections, wound care, and monitoring vital signs require more than just theoretical knowledge. They demand practice, precision, and real-time feedback from experienced professionals. Moreover, the subtle nuances of patient communication and bedside manner can be difficult to grasp in a virtual classroom. These interpersonal skills are crucial for building trust and effectively assessing patient needs, nuances that are best captured in person rather than through a screen. Recognizing these gaps, some online nursing programs are incorporating hybrid models. These models blend online coursework with mandatory in-person sessions. Students might spend hours on theory and simulations online, but are also required to complete certain hours in clinical environments under the supervision of qualified professionals. This hybrid approach attempts to balance the convenience of online learning with the necessity of hands-on practice. Yet, despite these efforts, the tactile sensation and the immediacy of physical practice in nursing cannot be completely mirrored online. While online programs strive to offer comprehensive experiences, the tactile learning component can be tricky to fully replicate. Education is an investment, but how much should it cost? When we dive into the realm of nursing education, the cost factor swings significantly between traditional and online courses. For starters, tuition fees for online nursing programs are often lower than their brick-and-mortar counterparts. The absence of physical campus maintenance and fewer administrative costs allow online institutions to reduce their tuition. Beyond tuition, commuting costs are a considerable expense for traditional students. Daily trips to campus can add up, not just in terms of gas or fare, but also the precious hours spent in transit. In contrast, online students often only need to commute as far as their home office or kitchen table. Then there's the question of materials and textbooks. While both types of courses require these, online students frequently benefit from digital versions, which can be less expensive and more accessible than hefty printed tomes. Accommodation is another major cost traditional students might face, especially if relocating is necessary. Online students, meanwhile, can study from anywhere, potentially saving thousands on dorm rooms or apartments. Online education can be lighter on the wallet, yet there's more to consider than just cost. Ever been frustrated by a bad internet connection? Imagine that happening during your exams. This is the reality for many students in the realm of online nursing education, where the dependency on technology is both a lifeline and a potential pitfall. In today's digital age, the ability to log in from anywhere and access educational resources is revolutionary. It means that learning can happen on your schedule, fitting around shifts at the hospital or family commitments. However, this convenience comes tethered to the reliability of technology. For students taking online courses, a stable internet connection is not just a convenience, it's a necessity. Picture this. You're in the middle of a critical exam or a live simulation, and suddenly your screen freezes. The clock is ticking, stress levels rise, and there's nothing you can do but hope your connection restores quickly. Moreover, the requirement doesn't stop at having internet access. Students must also have up-to-date hardware and software. This means that those who can't afford the latest gadgets might find themselves at a disadvantage, struggling to keep up with course requirements and software updates. Technical glitches are another unwelcome guest in the world of online education. They can occur during the most crucial moments, like exams or during live patient assessments, potentially impacting a student's performance and ultimately their grades. So while technology has opened doors to innovative educational experiences, it also demands a high level of dependency on digital tools that can sometimes fail us at critical times. Technology is a double-edged sword. It enables and restricts. Self-discipline is key in online learning. Do you have what it takes? Imagine the world of online education as a vast ocean where each student sails their own ship. Unlike the structured paths charted in traditional classroom settings, online learning presents a sea of freedom that requires you to navigate your course independently. This freedom is empowering, but demands a high level of self-discipline and intrinsic motivation. In a conventional classroom, the physical presence of instructors and peers acts as a compass that guides you. There's a set schedule, a bell that tells you when to move, and the immediate feedback from face-to-face interactions. This environment naturally fosters a sense of accountability and motivation through shared experiences. Contrast this with online learning, where the structure is more fluid. You are the captain of your ship, with the freedom to plot your course. However, this freedom also means you must be self-motivated enough to engage with the material on your own schedule. The absence of immediate physical presence can sometimes feel like sailing in foggy weather, where it's easy to drift off course without constant self-checks. Effective online learners often develop robust personal strategies to stay on track. They set regular study schedules, create personal deadlines, and find ways to connect with peers and instructors virtually to maintain a sense of community. Self-discipline in online learning isn't just about adhering to a study schedule. It's about actively engaging with your learning environment and taking initiative. It's about making sure that even in the quietest moments, you are pushing forward, not because someone tells you to, but because you want to succeed. Online education demands a strong personal commitment, which might not be suitable for everyone. As we've explored the various facets of online nursing education, the question remains, what's the right choice? Now let's take a step back and weigh both sides of the coin. On one hand, the flexibility of online courses is undeniable. They allow students to learn at their own pace and on their own schedule. This can be a game changer for those who may be balancing work, family, or other personal commitments. However, this flexibility comes with its own set of challenges. The lack of hands-on experience can be a significant hurdle. Nursing is a profoundly practical field, and the tactile skills that are crucial can be difficult to fully develop without physical practice and real-time feedback. Cost-effectiveness is another major advantage of online education. Generally speaking, online courses can be less expensive than their on-campus counterparts. They often eliminate the need for commuting, housing, and various other fees associated with traditional college programs. Yet, this cost saving must be balanced against the potential over-reliance on technology. Technical issues can disrupt learning, and not all students may have equal access to the necessary equipment or internet connectivity. Moreover, online learning demands a high level of self-discipline and motivation. Without the structure of a traditional classroom, students must be particularly self-driven to succeed. In conclusion, the decision to pursue an online or traditional nursing education isn't one size fits all. It deeply depends on personal circumstances, learning style, and career aspirations. Whether online or on campus, the path to becoming a nurse is noble and demanding. Choose the one that aligns best with your life situation and career goals.